Let's continue our focus now on World Health Day. South Africa's public health sector is under immense pressure. The healthcare system can be viewed as a reflection of the social issues the country is facing. Professor Renata Schoeman is the head of healthcare leadership at Stellenbosch Business School. Joins us now for a discussion on this. Prof, thank you for making time. I think efforts have been made in, the last 3 decades to improve the quality of public health care. But have those been enough? How do you assess the state of healthcare in the country right now?
Over the past 3 decades, great strides definitely has been made in bringing services to people that didn't have access before. We've increased life expectancy from 57 years to 64.8 years. The infant mortality rate has decreased. The 5-year-old mortality rates of children has decreased. Yet, we see still great inequality, especially in terms of provinces. So where the poorer provinces, the infrastructure is just dwindling even more, Limpopo, the Free State. So despite spending, the spending on healthcare definitely differs from province to province. And also the overburdening of the system is not improving. We are also losing healthcare providers, specifically doctors, either from the public sector to the private sector, where they feel maybe they have better support or they have more predictability. But we also have a lot of doctors emigrating, where they are worried about the implications of the NHI in terms of sustainability of their private practices. Mm-hmm. And although there are a dire need for more healthcare providers within the public sector, post has been frozen. So even if people want to work there, there's no positions that they can apply for.
And what's the reason behind that?
There's a number of reasons. One is just not enough budget. But on the other hand, in certain areas, there's definitely enough budget, but there's inefficiencies. We know that there is also corruption, and there's not enough of an effort made for attracting and retaining talent within the public sector.
So the deterioration of our health system has really been evident all around. I think you've mentioned the Free State, you've mentioned Limpopo, and there are many other provinces that are really struggling. What do you think is mostly the problem here, Prof? What is government not getting right? Are we talking here about infrastructure challenges? Is it the lack of repair? Is it the mismanagement of funds? Or is it simply just that the infrastructure is declining, and as you mentioned, there's not enough doctors and the posts have now been frozen, so you can't get new health workers into the system?
I think it's very important to know that health is a systemic issue. You cannot only put it at the Department of Health or the government to look after health. It is definitely on more than one level, and we also need to take into consideration South Africa's specific burden of disease and also poverty and other socioeconomic difficulties. But if you look at the healthcare per se, it's definitely a lack of strong leadership that's ethical, that really are qualified to view health as a systemic issue and understand that it is both in service provision, but it's also in terms of allocating resources, supporting resources, and getting rid of inefficiencies. Mm-hmm. Secondly, it is maintaining what we have, but there's also a lot of education that needs to be done on the healthcare users, so the patient. We are all responsible as citizens to look after ourselves, because if we can prevent certain non-communicable diseases, such as obesity that can lead to diabetes and hypertension, etc., we also can decrease the strain that we are putting on the system.
Mm-hmm. The country's healthcare is also chronically understaffed, as you mentioned, and I wonder to what extent that has an impact on the kind of service that the healthcare workers who are understaffed are delivering to, just South Africans who rely on public health services. Because I imagine they now have to do more and take in more work because there's not enough staff to share that responsibility.
So So we are chronically talking or repeatedly talking about the impact and burnout of medical professionals, both in the public and the private sector. Now, if there's not enough staff, whether it's sisters or whether it's doctors, and for example, in South Africa, we have roughly 6 doctors per 10,000 people, where countries such as Brazil have 20 per 10,000 and Russia 40 per 10,000. So we definitely, even if we compare to comparable BRICS countries, we definitely are short-staffed. So we have an increased burden on the healthcare provider. We burn them out. They leave or they become ill. But the irony is we say we need to train more doctors. We train more doctors, but then the government do not provide positions for them to stay employed within the public sector. There's so many community service doctors that doesn't have positions this year to work in. And also what we then see is, as I said, people leaving the system. But then also, I don't have to repeat, there's so many headlines that we've seen over the past couple of years of hospitals and that are so dilapidated and the care that's substandard that's provided to patients. But part of it is not having the necessary infrastructure. But then I also think we all should evaluate the ethics of people. You're still under an ethical obligation to do the best what you can, even if there's limited resources.
Yeah, I remember the recent report that the Office of the Health Ombudsman released a couple of weeks ago, confirming that pregnant patients at Rahima Musa Mother and Child Hospital were forced to sleep on the floor. That report also cited a leadership problem at Gauteng hospitals. You spoke earlier about a need for strong leadership. What do you think needs to change in order for us to have hospitals that are capacitated by people in leadership positions who know what they're doing and who understand the healthcare sector and also view it as a systematic issue? Because the health ombudsman said part of the problem is that, you know, the way you appoint CEOs is also problematic.
I think that is so important, and often leadership positions do not necessarily have to be a doctor, if you look at a hospital, for example, but definitely someone that understands health systems, health policies, healthcare leadership, value-based healthcare. So in order, how can I improve the value I deliver with patients to patients without increasing cost and still improve the quality of the care that I give to patients? So if you are only trained in a different field and you're also not trained in a systems perspective and understanding how, for example, the energy crisis and higher education and transport and the supply chain, how all of this fit in together, you will have a very short-sighted view maybe of what is happening in a certain hospital. So it's very important that we do upskill leaders. And that's where we, for example, are a great example of where we have a healthcare leadership program where someone from any other area or industry can come and qualify to go back into the public health system and really make a difference.
Yeah. We've spoken about the quality of healthcare delivery in our public hospitals and how it's been deteriorating. And I'm just wondering, Prof, if hospitals will actually meet the high standards required by the National Health Insurance. I mean, many health facilities have been failing the norms and standards that health institutions need to comply with before the NHI is implemented. So how ready are our facilities for NHI?
It's a huge problem. I visited the facilities where I trained a bit more than 2 decades ago, and there's not less money. The money that was allocated to these facilities have been the same over the years. So where is the money going? And that is a big concern for me in terms of inefficiencies and corruption, because how is it possible that you have more money but you do less? That's the one thing. The second thing is, if we look at it in terms of the NHI, what is a big concern for us looking at it is a great ideological view, and universal health coverage should happen. However, the NHI only provides for the finance aspect of healthcare reform. But if you look at healthcare reform needs to be both about the funding model, but also very importantly about a restructuring of the service provision. Now, if the NHI is going to be enforced without making sure that we actually have the necessary talent, we have the necessary qualified personnel, we have the facilities where the services are delivered, we're just going to see a bigger waste of money.
Professor Renata Schoeman, thank you for joining us for this important conversation.